A lot of people come to me for breast augmentation. Usually, when you're on hormones, when a male to female trans girl is on hormones for a few months, she'll develop breasts. Usually you get an A cup. That an A cup could be a small, a medium, or a large A, but it's usually an A cup, I'd say, in 90% of patients. If you're a little on the chubby side, you'll be a little bit more because you're chubby to start with. You may have little breasts to begin with, but the average person gets an A cup. Occasionally, I'll see someone just on hormones get a B or a C cup, and maybe they don't need any other augmentation after that. But if they want to be a little fuller breasted, we put in implants. Now, for the last 15, 20 years, we used saline-filled implants because the old silicone gels were taken off the market wrongly because people claimed that they got all kinds of medical complications from those old silicone gel implants. That was all untrue. And after more than 15 years and many, many studies done by the FDA and by the implant companies and by many plastic surgeons, it was proved unequivocally that silicone gel implants don't cause any disease. There are complications which can occur with any surgery, including breast augmentation. But you don't get any systemic disease. You don't get some immune disease. You don't get diabetes or cancer or anything else. Actually, they're even better than they were before. Better in what way? Better because they're more natural. They feel natural. They look natural. And they don't leak at all. The old implants leaked a little bit. It really didn't cause any diseases, but it leaked a little bit. So people made a big deal out of it thinking it caused diseases, which it didn't. But the new implants don't leak. As a matter of fact, they're really a soft solid. They're called cohesive gel implants. You can take a big bread knife and cut them right in half. I could show you one, but you can cut them right in half, hold both halves up, and squeeze them even, and they won't leak at all. They just don't leak. So you can get stabbed or shot even, and you'll have much worse problems than your implants. The implant won't deflate. The old saline implants, if you developed even a pinhole leak in it, the whole thing will eventually deflate. You have to replace them. It's not dangerous, but you have to replace them. The new cohesive gel silicone implants, if you get in a terrible accident, get a crush injury to the chest, or somebody stabs you or shoots you, or God forbid something happens like that, the implant still won't deflate. The worst that will happen was the breast might become, the implant and the breast might become a little bit misshapen, a little bit deformed. And if that happens, we just take it out and put a new one in. All implants are guaranteed for the rest of your life against rupture. So if they rupture for any reason, if you get in a car accident, not your fault at all, the implant company will still give your surgeon a free pair of implants. It's true. And at least that won't cost you money. You may have to pay for the surgery. In my case, I don't charge for surgery if someone has a ruptured implant. I don't charge for any surgery, as a matter of fact, for any reason, up to 1 year after the procedure, on any procedure that I do. Because some people charge for revisions when they revise something, and I just think that's wrong. I think you saved and paid a lot of money for surgery, and if you have a complication, even if you got in an accident, even if you went home and fell down the steps and something happened to any of your body parts that we operated on, I want you to have the best result possible that you can have. And I want you to be happy. I'm happy to redo that surgery or repair it or whatever happened to you. If you tripped over your own shoelaces and fell down and hurt yourself, I'm happy to redo it at no charge. If we have to go in the hospital, you have to pay the hospital fee and the anesthesia fee, but no surgery fee for 1 year afterward. And even after that, if you need something, I always give my patients, my existing patients, a good price because they're already my patients. And I want to take care of them and help them along their way. When we do breast augmentation, we use the new cohesive gel implants. You can do it under local or general anesthesia. I recommend general anesthesia. It's a little bit easier. We can put in less local injection and less narcotics and sedatives. When you do things under local with sedation, we have to give a lot more narcotics and sedatives. That's what makes people sick more than general anesthesia. If I'm going to have surgery done, just put me to sleep. I take a nap for a couple hours, wake up, and whatever we're doing, it's done already, it's painless, it's over, it's finished, and I don't get all drugged up with a ton of narcotics that they give you in order to keep you comfortable enough to withstand the local anesthesia when you're doing a larger procedure. If I'm going to take a mole off or some little scarf revision, okay, local, but not for any of the regular procedures. And there are a number of choices that we make when we do breast augmentation, and we can go into a lot of detail about this, but briefly we have to decide on the size, and that's really up to the patient. So I recommend that you get a pair of implants that are and breasts that are proportional to the rest of your body. Beauty is well proportioned. One of the nicest parts of beauty, one of the reasons of someone being beautiful or not beautiful, is the proportion and the balance between features of your face and the proportions of your body parts one to another. If someone comes in with a thin little body and gigantic breasts, you don't want anybody just talking to your breasts all the time, because that's mainly what they see. You want them talking to you, and your breasts and the rest of your body should all be in very nice proportion. And that's, to me, something to do with natural beauty. So, but still, it's a decision that the patient makes. Now, I'll be a little flexible. I'll lean to the larger side or the smaller side, depending on what you want. And we'll choose a size of implant that's, that you want and is proportional to your body and that we can fit into your body. And we have to decide where to make the incision. Usually, when we do breast augmentation in a trans girl, we usually, and we're going to use the new silicone gel implants, we usually make an incision in the crease under the breast. The future crease, because the current crease under your breast is much higher. If your breasts are going from an A cup to a C or a D cup, that crease is going to be an inch or 2 or 3 lower than it was before you had larger breasts. So the surgeon has to know from experience where to place, where that new submammary crease is going to be. And we place the incision line right in there. We need to make a fairly large incision, at least a couple of inches, 2 or 3 inches long, depending on the size of the implant. Because the silicone gel implants are pre-filled. They come already filled up. The old saline implants come deflated. We roll them up into like a little cigarette, and we can put them in through a little incision and then blow them up through a little fill tube and then snap out the fill tube. So we could get away with a tiny 1-inch incision, either in the crease under the breast or at the edge of the nipple, areola. You can't do that with silicone gel implants because they're pre-filled. So usually the best place to put that incision, we could do it under the crease under the breast, we could do it under the arm, and an incision under the arm. I don't like the arm as much, because if you're wearing a halter top or a bathing suit or just an off-the-shoulder blouse or dress, and you pick your arm up, I don't want to be able to see a scar there. If I'm combing my hair somewhere, whoops, a scar under each armpit. If you're laying on the beach or at a pool and your arm's up, oh, what a nice sunny day it is. Oops, I forgot I have a scar. Or somebody's walking by and they notice a girl with a nice sized chest wearing a little bikini, and she's laying there with her arms up and they see a scar under each arm. Whoa. Now usually they heal very well, but to me I don't like to put scars in areas which are easy to see. So I think that the best scar, I can't put them there. If someone wants them, I'll do it. But I think the best incision line for breast augmentation is in the crease under the breast. We have to decide whether to put it above or below the pectoralis muscle. Pectoralis muscle only covers the top half of the implant, because the pectoralis muscle comes down across the chest, and from the nipple level outward, a line from your shoulder down across your nipple. From there down and out, there is no pectoralis muscle. Pectoralis muscle only covers the upper inner 1/3 to a half of the breast. So we put the implant under there. The lower part of the, at least half to 2/3 of the breast is not under the muscle. I recommend putting it under the muscle if someone's very thin. If you're very thin, it's easier to see the outline of the implant. You see a well-defined circle. If you have at least a little bit of breast or a little bit of fat under your skin, you don't see that. And then I think it's better to put it over the muscle, because it will give a nice smooth décolleté area. You won't see the edge of the implant, and you don't damage the muscle. When you put the implant under the muscle, you have to cut its attachment on the lower outer part of the muscle to lift it up to get the implant under it. And then that edge of the muscle is always free. You've detached part of the muscle. What does that do? Number one, it can make your arm 10 to 15% weaker, because your pectoralis muscles have to do with arm strength. So there are some articles in the literature that show that your arm strength can be reduced. Number two, because that edge of the muscle is free, when you flex your muscles, the breast can bounce more, can bounce around. Number three, it can, sometimes when the edge of it flexes, the edge will dig into the breast implant and make a groove across your chest. And it looks very weird to have this, when you're pushing something closed or picking something up, that all of a sudden it either bounces, it jumps a lot, or it makes a groove, a gully across the middle of your breast, obliquely down in line with the edge of that pectoralis major muscle. Also, as we get older, everything droops. whether we like it or not. And breast droop too. So breasts usually just sag down lower and lower, breasts bottom out. The bottom half of the breast bottoms out, the top half gets flatter. However, when we put implants under the pectoralis muscle, a strange thing happens. The breast tissue starts to slide down off the implant and the muscle. The muscle and the scar that forms around the implant keeps the implant high. Matter of fact, underneath the muscle, it's a very open space. The implant can even ride up abnormally higher, and that's a common problem with submuscular implants. So when the breast ages, it can slide down off the muscle and the breast, and it makes what I call a Snoopy breast, or some people call it a double bubble. You see the implant and the muscle, and then another bulge of the breast, a double bubble, or a Snoopy breast. Well, I don't like that. You can get it corrected with surgery. You need a breast lift to correct that. But if you don't need it, I'd rather not do it at all. I'd like to damage the least amount of tissue as possible when I do surgery. I prefer to put the implants on top of the muscle rather than below. And my only exception to that is if someone's very thin. If someone just wants it, I'll do it. But I think it's unnecessary, and they're creating potential problems that they don't need. It's a little more complications possible when you put an implant under the muscle. I'd rather have less complications. So that's the breast augmentation. And breast, I could show you dozens of pictures. I've done about 3,000 breast augmentations now. And the results are usually very good. Are there risks? Of course. The same as with any surgery. You can have bleeding, infection, a bad scar. Usually, very unusual. Infection occurs in a fraction of 1%. I think I've seen one infection in 30 years. Very rare. Bleeding occurs supposed to occur in about 1% of patients. In my series, it occurs about 1/4%, where you have to, usually it's because someone's too active. They're running around the day after surgery and they cause bleeding. We have to go back to the operating room and drain the hematoma, a collection of blood and blood clots, because they've been too active. They got in an argument or something, and the blood pressure goes up and they start bleeding. You have to keep physically and emotionally calm the first couple of weeks after any surgery. It occurs overall in about 1% of patients that have breast augmentation. The two long-term potential problems in breast augmentation are rippling. All implants ripple. Saline does it even more. The new silicone gel, less. But they can still ripple. All implants ripple. That's one reason I like to put it under the muscle if you're skinny. If the thinner you are, the more you can see the rippling. It's not dangerous, it just looks funny. You can see it and feel the little waves. If you have a little bit of breast and or a little bit of fat, you don't see it, and it's no problem at all. So that's one of the reasons I put it underneath. So rippling is one long-term potential problem. Not dangerous, but just a cosmetic problem. Number two, the most annoying long-term problem which can occur is abnormally firm, hard, and round breasts due to what we call fibrous capsule contracture around all implants in our body, but especially around a soft round implant. A fibrous scar forms. That forms around any implant you put in the body. Scar tissue has a tendency to contract. If the scar contracts down around this soft, round implant, and it can contract very easily around a soft, round implant, it can make the breast abnormally firm, sometimes hard, sometimes uncomfortable. And if the scar squeezes a little more in one direction, it can displace the implant. So you can have an upward or inward or outward or downward malposition or dislocation of the implant. We can correct it, luckily, but we have to go back to the operating room and do what we call a capsulotomy. We open up that capsule, make the space large again, reposition that implant. Sometimes an inexperienced surgeon, someone who's not properly trained, they'll make a large cavity when they do breast augmentation, and they'll connect the space of one breast to the space of the next breast. And so it's like one big breast, and you don't have a shape of a normal breast. Luckily, it can be corrected by someone that knows how to do it. We have to take the implants out. We have to suture the skin down to the edges of the sternum in a nice round way so that it's normal, and then put the implants back in. So some people call that uniboob or other names, but medically it's called symastia. It's like one big breast because of surgery that was done improperly.